Good morning, sir.
Good morning.
Good morning, sir.
Yes, good morning.
Good morning.
Very good morning. They just check, say, I have kept the chat on. No, wait. Turning the chat on. Now, what are the options? Can you send the message to everyone, or you can send the message to me only? Can anyone just check it and tell me?
Actually, sir, both. We can send.
Yes, sir. Everyone available.
To everyone also. Okay. Because last time. Okay, now just check it.
Yes, sir. We can send only to you.
Just a minute, let me raise the volume from my side. Yes, go ahead.
Now we can send only to you, sir. The message.
Okay. Okay. So I'm keeping the chat on another screen. So you can even send a message also.
Good morning, sir.
Good morning.
Good morning, sir.
Very good morning. Okay. So we'll start within next 2-3 minutes.
Sir.
And just before a minute, question was asked that what if centipede insect bite tree? So I got your email. Yeah, about us. I'll reply. Are you there?
Yes, sir.
Okay. I reply to this. Say as such, you don't have to worry about if there is any bite. In the treatment, this treatment is as such 3 parts. One, the moment there is bite, you have to clean the area with a simple water, right? Clean it very properly. Now, 2 things. If there is redness, so you can use hot water, but if there is inflammation, so then ice pack is very much useful. Now, whenever these insects bite, so it leads to allergic reactions. So you'll be requiring the treatment, what is called as the antihistaminics. Antihistaminics. How will you know that you really need antihistaminics? Because there'll be redness, there'll be sweating, right? So two medicines, they are very effective. One is very standard medicine, which we normally take even during the cold also, what's called as the cetirizine. Now, because the cetirizine, it can cross the blood-brain barrier, so person would be feeling very sleepy. So the newer version, you can go for levocetirizine. Right? Levocetirizine. And if the inflammation is much more, so then corticosteroid cream, it can be applied. Say, whenever you'll be coming across, say, for example, soframycin, right? So soframycin, this is the antibiotic. But whenever it will be written like sofracort, sofracort. So then that means that this is antibiotic along with the corticosteroid. So these steroids, whenever if it is taken orally, it is addicting. It is like a Ramban ilaj. Sometimes when situation is bad, it is a life-saving thing. But there is a method to take it, and once someone has started, it has to be tapered gradually. You can't stop it suddenly. So as far as possible, it should be avoided. But this is the standard treatment whenever there is any of the insect, right? If it bites. Okay, I think it's time we start. So today we'll be talking about the second part of the language of anatomy, and we shall be revising. Wait. Just a minute. That is also, Isha, this is right. Because this exactly what has happened. There are so many emails. When did the lecture start? It was just before 2 minutes.
Good morning, sir.
Good morning. Acha, chalo, this is much better. Say, I'm turning the chat off. You can ask that question straight away. Isha, your suggestion is true. It happens like, because there are so many chat now if I start reading it, then you can send a mail, because in mail you write very conveniently and it is open on this. No worries. Chalo. That's better. Okay. Let's start with our today's topic. Now, this is second part of language of anatomy. Some of the queries which were there, so we'll solve all of them. This is standard Tuesday, Thursday, Saturday for those who are just joined, right? Tuesday, Thursday, and Saturday at 10 o'clock we'll be meeting. Zoom meeting ID is given. If you are over here, you already know that, right? It is 2511251175. Passcode is 253069, which will be activated at 9:55. Again, this is for all those who have joined today for the first time, as there were 9 emails that passcode is incorrect, because all of you tried to join at around 9:50. Remember, this link will be activated at 9:55. So no need to come early. Don't waste time. Just come exactly on dot and we shall start. Right? We won't be waiting much, just 2 minutes or 3 minutes past 10 and we shall start. Okay. All right. All these lectures, right? All, right? What we'll be discussing about the general anatomy, they are already on my YouTube channel. So you will find that even the notes, they are also same. But over here, because we are talking live, so there might be some new things. There'll be definitely some new things. But in case if someone has missed, as you said that, say someone, your relative passed away and unable to join, etc. Right? So totally understand that. So at least you can have that lecture on the YouTube. That's brief about me. And this, yes.
Sir, we have to write this lecture. Notes.
You don't have to write any of the lectures. Say, taking the notes, that is purely on your discretion. If you feel like that you want to write something extra, so you can. But otherwise, there is no hard and fast rule. You just understand the concept. Bas, that's more important, right? And this is the link of asset. So you can scan this QR code or send a mail. This is important. Here it is. This is a mail. In case, worst case scenario, if QR code is not working or this tiny URL is not working, because I saw that sometimes it is not working. No problem. Send a mail to me and I'll send you the link, right? And you will get it. I was not able to join lecture on Thursday. Well, we can't revise just for one person. We can't revise the whole lecture. Understand that. More than 200 to 250 plus people are waiting. So we won't be able to revise. That's why I say do this thing. Do this thing. For today, it's different. On my YouTube channel, same name, right? Dr. Bankim Jani. And in that, if you go to playlist, General Anatomy, so there is Language of Anatomy Part 1, Part 2, all the lectures, they are in sequence. Right? So you will get a complete feel of it. Yes, it was taken at a very slow pace. So you can increase the speed to 1.5 times or maybe 1.75 to as per your convenience. But at least go through that, right? If you have not joined, last time. If you are present today, so then no need. So फिर you will be getting everything. Chalo.
No, excuse me, sir.
Yes, bolo na.
I wasn't there in the last lecture as well, but since I'm here today, would I be able to understand today's class?
Absolutely. And who is it? Reva?
Reva, yes.
This is for everyone.
Okay.
Don't be shy, right? Keeping everything open, right? All the rights. You don't have to even ask me for unmuting yourself. You can ask anytime without any hesitation. Because our entire intention is that initially we'll be going bit slow. Next week also we'll be going bit slow. The idea is that you understand that foundation properly. But once you have understood it, right, then me and you are on the same page, then we'll pick up the speed, right? And then remember one more important thing, there can be a surprise test at any time, right? Not because we have just completed one lecture, so not even next week, but next to next week onwards, anytime, right? I have full plans for that surprise test because all of you said yes, correct? Yes, so many.
So
हाँ, बोल.
actually, I was there in the last lecture, but I wanted to ask that in the YouTube channel there are 15 lectures, only 15 lectures, and after that, what we can do if we want? After that, the university starts there, and the lecture. If we aren't able to join the lecture, so
हाँ,
the recorded session are there, or we
yes,
can.
recorded sessions are there. And another thing is, as soon as all of you will be starting with your university, we'll be shifting these lectures to weekends, right? We'll ask all of you that what is the suitable time, the time which is convenient to everyone. So it might happen that we might be, and so it will be on Saturdays and Sundays. Sunday is like absolutely fine. So yes, Sunday will take. And on Saturday, it might happen that we meet at say 8 o'clock or 9 o'clock in the night, but will not miss it. Right? And those sessions will be a bit longer so that we cover the entire week. The idea is, I'm telling you very honestly, it happened for last 3 years. Right? Listen very carefully. It happened in last 3 years. Initially, the count is very high, but then gradually, I don't know, I don't want to insult any of the seniors or any of the teachers, but then I get the feedback there is no need to learn in that much detail. And then gradually the presence drops. And when it drops below our patients, then with heavy heart, we had to stop the lectures. It happened last 3 times. And when I say that this is the email address, till you are mbbs@gmail.com, this is the intention. Yes, I teach you pathology, pharmacology, everything, what the subjects which are in second year, third year, everything. But it is painful when you see the presence. I mean, we have got 1100 licenses. Right now, there are roughly 300 students. Excuses when they come that this is too early. Abhi to vacation hai, this is too early. I feel like that is 10 o'clock too early? No, na?
No, sir.
Ah,
No,
No,
but,
sir.
but such emails, I have replied to everyone. I have replied to everyone that please don't do this. If there is a genuine reason and if you're not joining, I can totally understand. But it is like I wake up at 10:30. So boss, that is unpardonable. So, and yes, some of the batches, they were taken at 2 o'clock in the night, Indian Standard Time, 2 o'clock in the night, right? I used to sleep at 9:30, wake up at 1:45, take the lecture, and then again go to sleep. And remember, say at 4:30 is my time on tracks when I go for running. So in many of the cases, say if the lecture is extending all the way till 4 o'clock, so then I straight away on the tracks. But I need that sincerity even from your side. If there is any problem, if there is any trouble, let me know. Let me know. Right? We'll adjust the timings. But right now, it is like a vacation. No? So 10 o'clock is absolute. It should be absolutely fine.
Yes, sir.
Yes,
Huh.
sir.
And so this is a link of assets. Assets means this particular PDF, which we will write everything, that will be available immediately as soon as we finish the lecture. And this is the tiny URL, or if this QR code, or if this is also not working, send a mail to me. I'll send you the link immediately.
Yes, sir. Yesterday, this URL was hanged, like from my side, it was not opening.
Okay. Okay. In which month the Gav start? I think somewhere around Diwali. Somewhere around Diwali. We have got enough time. And gradually we'll increase the pace also. Chalo. Some of the emails, some questions, so they were same. Right? What was asked in last batch? That also. Say BD Chaurasya, volume 1, 2, 3, and general anatomy. These are the 4 volumes. So upper limb thorax, 1 volume, head and neck and brain, 2nd volume, lower limb and abdomen pelvis, 3rd volume, and general anatomy, 4th volume. You have to buy? Yes, you have to buy. Right? Sambulingam, that is for physiology. It's a good book. You can surely buy. My favorite, that is a different thing. My favorite is Guyton, right? But Guyton is something that you'll find it difficult when you will be appearing for exams. It is wonderful book, right? I have read it with such a pleasure, not once, but many a times, right? And I appeared in exam reading Guyton only. So sometimes someone would say it is very difficult to appear for the exam reading Guyton. No, you have to make your own notes, right? And we'll come to that point also. Satyanarayan, Raghu Satyanarayan, Biochemistry, very fine book. Very fine book. Reference book, Harper, thick book, big book. So depending upon our capacity, we can go for reference books, but not initially. Not initially. One very bitter mail was there. I won't be taking name, right? Don't worry about it. You can write, but don't use such words. थोड़ा बुरा लगा था मुझे. So I thought that, and I can see you are there, right? The thing is, say, I'm asking, say you can even reply by email. Am I teaching you very difficult things? मेरे दोस्त अगर जो ये डिफिकल्ट लगता है तो आगे तो देखो there will be so many things. Even today also you'll be coming across certain words. Yes, you have to remember everything whatever is taught. And when you said कि इतना burden this that etc दोस्त अभी burden दिया ही नहीं है मैंने. The day I'll start giving you the burden ना, say I'm very friendly, but जब पढ़ाई की बात आएगी and when I'll take the exam and in case अगर जो आपने कम मार्क्स स्कोर किए तो then the mail which I'll send you, you have to really take a printout and photo frame it. बस अगर जो आपने वो चीज मान ली ना, trust me, I'll take you to international level. I always tell this thing, give your 2 years. This I tell it to my IT students. For medical students, this duration might be different. But I tell to my IT students, give me your 2 years, I'll take you to national level. And give me your 3 years, I'll take you to international level. When I'm telling you, and same thing I'm telling you even for the medicals also. So, अभी तो मैंने कुछ सिखाया ही नहीं है आपको. So, इतने में घबरा मत जाना, right? And ये डिटेल नहीं है, this is compulsory. इतना तो पढ़ना ही पड़े. हाँ, गाइडन की बात हो गई, right? ये Chinese Korean drama, or this was a question not from this batch, right? So I'll just take it. This was a question which was asked in the last batch. कि I am addicted to this. तो नहीं यार, ये addiction तो काटना ही पड़े. देखना हो तो देखो. I also see, right? I saw one of the very nice movie, Head of the States, right? Very nice movie. Idris and then John Cena, they were there. Very nice movie, must. And the movie shuru ho aur khatam ho pata hi na chale. One is the president of USA and second one is the prime minister of UK, and they are going in Air Force One. That is the plane of president of USA, and that thing is crashed by terrorists, and then the dhamal, right? All the way till the end. Both of them, Idris Alba, he is also an amazing actor. Must movie, must. Matlab for 1 hour 50 minutes you'll feel so happy. I saw yesterday's match. Djokovic got defeated, but it was expected. It was expected. right? And then on Sunday there is final, right? Wimbledon. Yes, I also do watch, but the idea is the target of reading 30 pages a day. Minimum is 10, but my target is always 30. This always remain. Right now, I'm working at a very high level on AI, and very soon you'll be getting some very good things even in our studies also. But for that, I need to work. So it is like I committed myself that I'll be working for 90 minutes every day. So yes, it is never 89, right? It is 90. Yes, someone
So
raised
is
it.
it compulsory to buy all these volumes?
Yes. These are the basic books. Now, if you are comfortable reading the digital books, no need to buy. No need to
Okay,
buy.
sir. Thank you.
But at least these are the basic books now. So I feel like that कुछ तो होना चाहिए. But still, again, it is your choice. Yes, bolo.
Actually, for BD Choresia, Head and Neck and Brain are two different books. They're not together. So we have to buy both of them, and then General Anatomy as well, right? So 5 books in all.
So now it has become 5 books.
Yeah, because Head and
Okay.
Neck and Brain are two
Oh,
different.
good that you said. Because I was not aware. This must be a new edition. So Head and Neck is a separate one, and then we have got the 4th one that
It's
is with the
Brain.
brain.
Yeah.
Okay, good. I'll just have a look at this. Nice. Thank you for informing.
Sir, latest editions are not available on ebooks.
Latest edition are not available. Okay. Give me some time. Some means by when we'll be meeting on Tuesday, I'll let you know. I'll just search for it.
Okay, sir.
Because in
We have to carry
cybersecurity.
them to abroad.
क्या बोल रहे हैं?
While carrying, when we will take the flight, these books might cost the vet and the I contact to the university ma'am. They said that there is no need to carry them, and we have all in ebooks. They said like that.
See, that's what I say. We have got 2 options. Ebooks, if you are comfortable reading ebooks, as I suggested to someone, because this Amazon is Amazon festival will be starting. So from 12 to 14, say there will be some discount. So whether it should go for iPad with 1 terabyte of space or 512. So that's what I say. Okay, go for 512 and then go for external storage, USB-C. So even if you go for 2 terabyte of external storage, you'll be saving some money. So when you've got so much of storage and if you're comfortable with the ebooks, I would say go for that. Right? No need to carry physical books. This is my habit. Right? Even today, I got even the Kindle also. I got the iPad Pro also. But still, some books which I love, I keep them with the physical book. In that physical book, I write with pen, and then even sometimes you feel like chalo sote padhna hai. So I use that. But it is purely on your discretion, right?
Sir.
Yes. Bolo.
So this you'll be teaching the entire MBBS course or just like what is necessary
That's
for
my wish.
USMLE and PLAB?
That's my wish. I told you about this. That's my wish, that I teach you even the last subject of the MBBS. And to help you till you complete your MBBS, that is help you even in the competitive exam. The problem occurs when the number, right now the number which is 307, why it happens like last time it was 357, why 50 people dropped, where are they, right? Because at times it happens like anything given free doesn't carry the value, right?
Yeah, but then if you will teach the entire MBBS course to us, like what will happen to USMLE and PLAB courses? Like, is it the same syllabus?
I told you last time about this. Whether you appear for USMLE, PLAB or any of the competitive exam, the course remains the same. There is difference in the pattern of exam. Otherwise, pathology and physiology, pathophysio and pharmac, these are the 3 prime things which are asked in USMLE step 1, right? So these 3 things, they'll be remaining same in the entire world. So if you know these three things properly, and then I say appear for USMLE mock exam, and then you see how wonderfully you perform. Right. So at this point of time, you don't have to worry much about any of those exams. Make your foundation strong and consistency. Bus. Right. Then feeling sleepy even at the end of the day. Well, straight away, I would jump to this question, right? As I got that email in which 3 emails were received with your B12 and D3 report. In one of the email, I said that it is dangerously low, not taking the name. When it is less than 200, understand it is dangerously low and it will be very difficult for you to focus because of such low levels of B12. That it is a water-soluble vitamin and it is very important for your neuromuscular coordination. D3, it is very important for your bones. When it is less than 20, so you are going into the insufficiency. Over here, the reports which were sent, all 3 emails, right? In one case, it is around 15. In second case, it is 8. My dear, 8. That means you are very much prone for fracture. So for this, right, I'll write down the very simple treatment. What you have to do is, I'll write it over here for D3, right? This tablet will cost 65 rupees. 4 tablets, right? It is tablet cholecalciferol, right? Cholecalciferol. It is 60,000 IU. And if the level is below 20, then you take today one. Say, for example, I'm writing Sunday, Thursday, right? Take one on the Sunday morning, one on Thursday morning. So this is, and then once again, next Sunday and next Thursday. That's how you have to take it for 2 months. I hope I am clear, right? Because this is a fat-soluble vitamin. So you don't have to take it daily. Plus you are taking 60,000 IU. When the level is less than 20, you need to reach to the level of at least 40. Because you are in the most effective prime powerful stage of your life. When the body is so powerful, in the 20s, the body is very powerful. It can handle any of the insults. Kuch bhi kachra, pizza, this, that, anything you eat, no problem. Body will resist, right? But see, when the levels are so low, so it is really very, very dangerous. Okay, so keep a track on that. Second, B12. B12 is a water-soluble vitamin you need daily. There are sublingual tablets. They are called as the sublingual B12 tablets. Sublingual B12 tablets, you just put it under the tongue, it will dissolve. It will bypass the liver metabolism. So when we'll be learning hepatic metabolism, at that time we'll discuss it in more detail. But this tablet, when the levels are less than 200, to start immediately, right? You know the ideal level? It has to be 600 plus. 600 plus. So if you are not very regular in your eating habits, not exercising, right? So yes, these 2 things, they are needed. So that was the sole reason for, and both these things, यहाँ पे B12 is for neuromuscular and D3 is for your bones, your muscles, your power, right? So if the body is weak, तो थोड़ी देर में थक जाओगे, right? You won't be able to sustain even longer lectures. And just one simple thing, whenever you attend, not only here, because I won't be able to see you, but keep your spine straight. ऐसा नहीं कैसे टेढ़े होके बैठे हैं, सोते सोते सुन रहे हो lecture. No, don't do that. Right? Just take it like as if I'm talking to you directly, one-to-one talk. So this is one. Depression, losing faith. Next Saturday, right? I'm just writing. Next Saturday, we'll be talking about in more detail. But if you are having this problem, mail bindas bhej do. Right? I'm replying to all such emails at an individual level, asking you only 2 things. One, why do you feel that you are depressed or losing faith in yourself? Because NEET में marks कम आए. अरे, I said, this was past. Cut it. यहाँ से शुरू करनी है life अब. This is like your new birth, right? You are born again. So cut the past. Forget about it. And if anyone is telling, right, so then simply who cares? Right? Simply, I'm getting your emails. Yes. We'll talk more about it, but that would be in general about how to keep yourself mentally fit, right? Few emails they were regarding how to increase weight, and few emails they were regarding how to decrease weight. So I think I'll mix these two groups. So जिनका ज्यादा weight है वो कम weight वालों को दे दें. Okay? The thing is on say if there is one simple thing, carbs, right? Carbs, carbohydrates. Carbohydrate, right? कुछ भी खाओ उससे पहले just check it. Pizza, pasta, bread, they are like heavy carbs. And heavy carbs, and then immediately they'll be converted to glucose. So there will be spike of glucose, right? Insulin spikes, that leads to all that resistance. And finally, it starts getting into the form of storage, right? Body stores it. So carbs, they are the culprit of your increase in weight. So simply do one thing, cut the carbs. Try to cut the carbs. If you just decrease the carbs, decrease the sugar, white sugar, it is 40 times more addictive than cocaine. Yes, 40 times. That's why. कुछ भी वो chocolate हुई, कुछ भी है तो ला मैं खा लूं जरा सा, right? And then you feel so happy because it is straight away dopamine effect. Straight away it is going into the brain. On Saturday, right, I'll take you to all 7 stages. All 7 stages. I think, yes, next Saturday, don't miss it. I'll take you to all 7 stages of happiness. Right? जरा सी chocolate खा ली, हाँ खुश हो गए. And बस, and then उसके बाद guilt. यार ये मैंने क्या किया? Am I so stupid? नहीं. Brain functions like that. Brain functions like that. उसको कोई छोटी happiness भी चाहिए. But when you clear your MBBS, right? Or ये सोचो कि you have completed your post graduation, you are cardiothoracic surgeon, and the day you save someone's life, that happiness, that would be not like a chocolate. That would be far more, right? There'll be layer by layer by layer. There are 7 layers of happiness. 7 neurotransmitters are there. So once you know, you'll be able to understand कि अच्छा, forget about ये छोटी-छोटी खुशियां, right? जरा सा खा लिया. No, then suddenly your level would change. You'll start finding happiness is कि चल आज का lecture, right? मैंने खत्म किया. Every point, आंख बंद करके, can I recollect everything? Did I understand every point? And yes, बिंदास जाके chocolate खा यार. You'll be so happy कि yes, that will be like a reward because it will it will take you to the pleasure level number 4. Right? So we'll really talk about it. And many of the problems would be solved. For increase in weight, I would say it is not only kha karo, proper exercise. Here also, to decrease the weight also, you can do the exercise. But on that day, we'll be discussing it in slightly more detail. That it is not so that straight away I tell you to everyone to start running at the speed of 9 kilometers per hour on the treadmill. Oh, that would be a crime. That would be a crime. So I need to know your resting heart rate. I need to know your diet plan to lose weight. Okay. I'll make it in general on Saturday, right? On Saturday. So we'll discuss the diet plan also on that day, surely. Right? On both increase and decrease. Till next Saturday, still there are 7 days. Cut the carbs and focus on protein. Bas itna, this is the mool mantra. Protein. Take more protein.
I would like to say the calorie deficiency also matters because I have done the 1-year course of diploma in nutrition and dietetics, and it teaches us many things regarding this.
It matters. It matters. But say, for example, when you take protein in more quantity and you do the power exercise, right? Like the power lifting. So the amount of, say, the advantage is, as I said, one is the basal metabolic rate. The dietitian, they give you the diet. Okay, you are doing this exercise. But then there are certain exercises that is, even if you stop that exercise, there'll be after burning effect. None of the dietitians, they consider that. So we'll be doing those exercises. You did the exercise for 20 minutes and then for rest of the entire day, your body is into that burning state. So it will give you endurance as well as it will give you the power. That is what is needed, right? Endurance, the sustainability that even for 10 kilometers, 12 kilometers, you are going strong, right? So running full marathon is what? It is not the power. It is endurance. Means it should not happen that by the end of say 30 kilometers, you are fully exhausted. So we'll discuss all those points. But the key word is if you cut the carbs and start the protein, see the difference. Your body will start transforming. That's why the calorie is like, say, for a body, if you eat one katori of moong, right? Sprouts, one katori of sprouts. So that will be like 120 calories. And you eat one gulab jamun, that is also 120 calories. But body will metabolize both the things in a totally different way. Totally different way. Because body understands that protein is broken, right? Those amino acids are formed. Amino acids, they are straight away, they can be used by the muscles. While over here, it will be broken down and finally it will be going into the form of fat. So our purpose would be quality food. And then when we introduce the calorie deficit now, then results would be awesome. So that is, and plus if we merge such exercises, that say, I'll be giving you the complete layout because everyone's body is different. So we'll talk about it on next. Haan, bolo.
Sir, what about those like some people have very high BMI and no matter how much they eat, their weight would not increase. So what about those people?
That's why I said that we'll definitely be talking on Saturday. Otherwise, today's session will be going on that only. So
Okay.
today cover a bit of ground. So insult in past, self-doubt, just received the email also. Yes. So don't worry. Insults in past, and that's what I said, past is past. Forget about it. Right? And doubt, it is not self-doubt. It is the thought which has been injected into you by someone. कि देखा उसका लड़का तो कैसा काम करता है, तू ऐसा करती है, ऐसा करता है या करती है. Never compare with yourself. But target is, if you are today at this point, progress a bit every day. Even if it is less, no worries. Even if you read one page, chalega. Right? You have committed to yourself that I'll read 5 pages. But for some reason, by the end of the day, you read only 1 page. No problem. No problem. It is not like an army rule. Right? Try to follow it, but keep bit of flexibility also. It's okay. But zero ka bhi nahi. Nahi. It should not happen. Okay? Classroom feel and this writing and you feel good. Thank you for that. Right? Almost this is like very good emails received every time. Work with studies, mat karna. Right? I understand there were more than 10 emails on this topic only. The day you will become parent, and if your kid would say, कि नहीं mom, नहीं dad, आपको थोड़ी तकलीफ कम पड़े तो I'll also start working. You would say कि बेटा, focus on your studies, be the excellent doctor, और then फिर हमें बुलाना, right? So don't worry much about it. Don't worry much about it, right? Take that thing as a responsibility. Responsibility. Okay, if your parents, they are spending this money, so then learn so effectively, kill the competition. When you go for interview, when you appear for the exam, there should not be any competition. Kill the competition. That's what my father taught me. Kill the competition. I mean, when you go for the interview, that company should think that I'll be the biggest fool on this earth if I don't hire this person. They should feel. Right? So, bus, this is the answer of it. I mean, after completion of my MBBS, and when I say that I acquired all those 23 international degrees in IT, was it by my money? No. Anyone would say, what fool he is after doing MD radiology with super specialization in MRI, and then he is going into IT? Yes, because it was my burning desire. I told my dad that it would take some time. My father said कि बेटा कोई बात नहीं, पढ़ना शुरू करो, खाना आ जाएगा. He used to get the tiffin, घर से टिफिन भर के, right, मुझे दे जाते थे कि तू पढ़. So that is the thing. And then the day I failed in one of the exam, right, passing score out of 1,000, passing score was 791 and my score was 790. I failed by 1 mark. I felt so bad. He said, no problem, wapas aao, right? Why it happened? And then we realized that there were 2 volumes. This is called as the SQL server. There were 2 volumes. So I was not having the second volume. I totally missed it. So then he said, no problem. Let's book the exam again after 15 days and got 1,000 out of 1,000. So it happens, right? Parents, so take that thing as a responsibility. Bas, nothing more. Take that thing. Unko nirash mat karna. Unki aankh mein aansu nahi. They'll feel bad only when you won't perform, right? Now, there are more than 320 people, so I don't know whether those 3 persons are there or not, but I think I have answered your question. Okay. How to improve yourself? Constant journey. Those constant journey. In every lecture, कुछ ना कुछ तो ऐसा discuss करते ही रहेंगे. If you follow, say for example, that spreader, right? I feel so good for the girl who said that I increased my speed. You touched almost 300, right? Effectively. Wonderful. Wonderful. But likho yaar, why it happened that there were only 11 emails received about the spreader. बाकी इन्होंने सबने practice नहीं की. If you have done. One boy said कि नहीं, my speed is not increasing. अरे दोस्त होता है. मतलब you guys तो you are so intelligent. मैं तो कुछ भी नहीं. मतलब till 10th तक तो पास होने में भी तकलीफ पड़ती थी, right? Because पतंग उड़ाना बहुत अच्छा लगता था. Then I used to read a lot, but किताब, स्कूल की किताब नहीं, बाकी की सब किताब. So when the essay was to be written on fish, my teacher called up my parents because I wrote an essay on dolphin, and in dolphin I wrote that why dolphins they don't suffer from Kaysen's disease, right? Because of their hyperflexible chest, and I drew the figures also, right? This was in 7th standard. So teacher said that if he'll start writing like this, so we won't be able to pass him. So my father said, now onwards he won't do like that. But I always did like that. But the advantage was then from 10th onwards, suddenly the things changed. So कोई टेंशन मत करो. You improve every day, right? Follow certain rules. जो मैं बोल रहा हूँ आपको. Should I tell you one rule which I'm still following?
Yes, sir.
The rule is where you have to give me a promise. अरे वाह, सुधांशु, your speed 320 नहीं होगी, 325 होगी, because increments are in 25. So from 300 you must have jumped to 325. बहुत मस्त. Very nice. Really nice. 325 is awesome. And target कुछ नहीं यार, you improve yourself. Important. पहला rule मैंने, I want one promise from this you, and the promise is you have to learn just one new thing a day. Just one new thing a day. But it should not. I think just mute. Mute करूं. Thank you. So one new thing a day. Just one new thing a day, and that should not be from medical. Course की बात नहीं है. मतलब you learned what is, say for example, what is aponeurosis. वो तो पढ़ाई की बात हुई. पढ़ाई के अलावा something other than our studies. So even if you learn that how this fan moves, right? What is the principle of motor, or what is the principle of dynamo? Bike में kick मारी, अब तो self starter, but still what? Self start is the battery is rotating that dynamo, right? The core. You learn one thing, even fuse कैसे बांधना. right? तो भी चलेगा. Any of such things, it is fine. One new thing a day. It happens like there are 400 popular science questions. So it will take about one and at the most, say 1.5 year. After that, what would happen? Suddenly your vision would improve. You'll start understanding when these type of clouds, will they rain or not? Right? You'll be able to say. You'll be going into the depth that what is the satellite picture, right? How to read those satellite pictures. So gradually, everything will matter in such a way, right, that you will start what is called as the integrating. You'll start integrating the things. Jamana jo aa raha hai, that is of integration. If you can do multiple things together, so it is like a company would feel that instead of hiring these 4 people, let me kick them off and hire this person who can do multiple things and pay him double. This is what is happening. When you hear that, okay, this company has 400 people, 400 persons were laid off because they never improved themselves. They were unable to integrate. वो गधे की तरह एक ही काम करना तो no. Now the world is changing. So this is like one habit. And the moment you start committing on this habit now, your eyes will say कि आज क्या सीखना है. सुबह से you will start. You are learning German language when I shabash. Very nice. Very, very nice. Learning a language, it is a very fine thing, right? So this is the thing. Now, when you say this is a promise which you have given to me, I won't be able to track it. You know? So this is like a soul-to-soul promise. Yeah. I gave this promise to my teacher, Matthew sir, who was in Xavier's way back when I was in 12th. Now he is no more, but still, promise is a promise. Regarding this fight with boyfriend or girlfriend, यार भूल जाओ. The thing is, ये एज ही नहीं है अभी फाइट करने की. ये एज ही नहीं है. Seriously, जितनी भी emails आई है ना, उन सबको एक ही बोलता हूँ कि boss, you reach to that high level, right? You'll be getting such options. So ये ना मोबाइल की तरह होता है कि यार अभी तो मैंने एक छोटा सा मोबाइल खरीद लिया. And the day you feel like, yes, now तो I can buy iPhone 16 Max Pro with 1 TB of storage. तो वो पहले मैंने क्यों नोकिया खरीदा था. बस it is like that. I think you got the answer, right? You are smart enough to get the answer. That's the thing, right? So don't waste time with any of the people who are wasting your time, talent, and the energy. Sudhanshu, you are exceptional. 425, but it requires extreme focus. No doubt about it, yaar. No doubt about it. Because and you must have noticed, okay, as you increase the speed, your focus keeps on improving. Right? Your focus would improve. So, तब कुछ सुनाई नहीं देता. बाजू में कोई बोल रहा है, कोई दूसरा कोई आवाज, कुछ नहीं. वो मतलब ये फाइट्स भी कुछ याद नहीं रहते. Weak fundamentals will make it strong. That's why we are here. Okay, simple. You sleep for 12 hours. ये नाम नहीं ले रहा, पर यार अगर जो तू 12 घंटे सोती है तो दैट मीन्स कि तेरे पास बाकी के सिर्फ 12 घंटे रहे. उसमें खाना पीना ये वो तो दिस इज अ क्राइम. 12 घंटे नहीं सोते. Just check your not D3, check your B12. Chances are extremely high that your B12 must be pathetically low. That's why it happens. Person feels drained out. Get your B12 checked immediately, right, and send it. And in such cases, if it is in between from 100 to 200, if that's your B12 level, you have to take this B12 tablet morning and evening, both times, right? Both times. You have to take one tablet in the morning, one tablet in the evening. It is crucial. Okay? Right. What if I fail? People will laugh. हाँ लोग तो हंसेंगे ना. So when your brain, when you think like, what if I fail? Brain never understands this. The principle of neuro-linguistic programming is like brain would always pick up a keyword. Now, if someone keeps on feeling like, what if I fail? What if I fail? Brain will say, forget everything. pick up the word fail. Oh, he or she wants to fail. Yes, then brain will make all the efforts that you reach to your goal. You reach to your goal. Ha, Vedant, go ahead.
Sir, for B3 and D12 tests, is there any fasting condition?
Is there any
fasting condition?
Not at all. Not at all. You can straight away give the blood and they'll give you the report within 3 to 4 hours. No fasting needed. Unless and until you are going for a liver function test and lipid profile. Then it is different. But otherwise, all the CBC or your RFT, renal function test, B12, D3, your sodium, potassium, no need. You can give straight away the blood and you can get the reports. So coming back to this is NLP, neuro-linguistic programming. If someone tells कि यार मैं fail ना हो जाऊं, he'll definitely fail. There is a difference between कि मैं fail ना हो जाऊं and I must pass. It is not same. Literally, it is same, right? But no, brain processes it in a very way. That's why they say कि never speak a negative word. छोटा बच्चा होता है इसको you tell गिर जाओगे. Right? But then he or she develops the fear of falling. But otherwise, if you even that 2-year kid, right, park में जाके उसको लटकाओ ऊपर, right, वो खिक लटकता रहेगा. They don't have any fear. All these things, they have been injected into you by some of the most selfish people on this earth. अब वो जो भी हो, मतलब I use these very harsh words, पर वो कोई भी हो. I tell this thing to every parent. कभी मत बोलो कि देख बाजू वाला का लड़का कितने मार्क्स लाया और तू कितने मार्क्स लाया, तू कितना डफर है, तू कितनी डफर है. And yes, this is answer to those dozens of emails. That's why at times I feel कि yes, this lecture वो एक दिन ऐसा भी रखेंगे when the parents should also join and they should understand कि yes, neuro-linguistic programming जाने अनजाने भी it is a very big thing. Because see, your brains, they are so wonderful. They are like a clean slate. और उसके ऊपर से अभी से वो इंक डालना शुरू कर दिया तो as soon as the pressure would come, first year, second year, ask any of the student, right, कि इतना पढ़ना है, and then they start going into depression, and then it becomes so difficult. मतलब some of my students, मतलब remotely I'm trying to treat them since 2 years, 2 साल हो गए हैं, still they cry. So क्योंकि एक साथ जब subjects वो वापस आने शुरू होते हैं तो then though they come in 3rd year but then they say कि इतने सब्जेक्ट 7 सब्जेक्ट मेरे वापस आए, कहां से कवर करोगे? So this is a race, this is a marathon right from the beginning. Hi Ishan, go ahead, you can ask any time, right? So people will laugh, don't worry about them. लोगों का तो काम ही ये है. Should I start making my notes? Bilkul, you can. And you asked the question that if I find Chaurasya comfortable, can I make notes from it? Bilkul. And in that notes, don't write running long sentences. Try to restrict yourself to those keywords. But that would be our intention, right? Keywords. Exercise routine, sure, Saturday, right? I'm not taking much time on that. It will be discussing isotonic and isometric exercises. So some exercises which you have to do every day, some of the exercises which you have to do it on alternate day or at least 2 times a week, right? So that when you go on the stage, so people should be getting the impression that wow, what a fitness, right? Because it is seen before you even speak. आपकी fitness stage पे दिखती है. People are watching you, so your body language would be different. So that's why this would be a very vital thing. What food is good for students? ये भी उस दिन बात करेंगे, जरूर बात करेंगे. I'm not against non-veg. I am pure veg. I don't eat even eggs, right? But yes, you tell me I do a deadlift with say 160 kilograms without any problem. Right? So that is a myth that you need those non-veg तभी body बनता है. No, systematically exercise करेंगे. Yes, it is needed, right? And there is a difference between male exercise and female exercise, and plus some precautions. Those precautions, like say if you're lifting heavy, so then there is abdominal belt of a very good company. If you buy, it will be costing just 500-600 rupees, but you will never suffer from inguinal hernia. It is called as the hernia. When the abdominal contents, that is the intestines, they start protruding, and then person has to go for surgery. There is no other option, right? Also, in case of female, means after pregnancy, that is after delivery, after parturition, then what happens is that suddenly they start losing control over their urine, right? So, वो होने नहीं देना. So why not to make your pelvic muscle so strong, so amazing that your rest of the life it goes fine. I always say it like कि भगवान की पूजा करते हैं तो बुढ़ापे में भगवान की पूजा करेंगे तो भगवान भी सोचेगा कि साला अब तेरे पास कुछ काम नहीं है तब मेरे पास आया है, right? किसी को if you want to give rose to your very beautiful girlfriend तो कैसा रोज दोगे? ये एकदम पुराना, उसके पास जाके दोस्त सस्ता वाला देना ना, वो 4-5 दिन पुराना भी चलेगा, 15-20 पंखुड़ियां टूटी होगी तो भी चलेगा, वो सिर्फ ठुड्डा देंगे तो भी चलेगा. Will you do that? नहीं, वो ढूंढ के वो बढ़िया सा निकाल के वो कहेगा इसका 50 रुपए एक्स्ट्रा लगेगा, हाँ चलेगा चलेगा. And when it comes to God, why not? It's when you are so fresh, so amazing, your brains are, God is what? This is when you understand that universal power. So I'll also make you meditation. Meditate. That also I'll teach you. In all these things, they are very necessary for competitive exam because everything will boil down to that focus, right? So we'll do that meditation session also. And then immediately after meditation, whether you want to do exercise or you want to say study, देखो कैसा focus है, how good you feel. And as it comes into your regular practice, by the end of the day, when you decide, say I go to sleep at sharp 10 o'clock, right? So even at 10 o'clock in the night, you won't feel like I'm very tired. No. And you'll sleep, मतलब just 2 minutes के बाद कोई देखे तो you are deep in sleep. You'll be completing your sleep cycles very effectively. Right? That is where your brain would be working fine because you're given even enough rest to the brain. Study alone or in group? Alone. Because when you are learning the concepts, study alone. Once concepts are clear, padhana hai, then you teach. Because there you want to say enhance your protein chains. Right? You want to make that study go into the permanent memory. So then you just teach it to groups. Blood report we talked about. And this was like centipede insect, वो कीड़े मकोड़े कोई जो काट जाए तो clean with hot water. If there is inflammation, put the ice pack and things will go fine because body's immunity, body's resistance power is reasonably good. Nothing happens. But in case if there is severe itching, there is severe redness, right? So then you can take antihistaminics. Cetirizine is fine. In fact, cetirizine should be taken and person, you will go to sleep. When you'll wake up, things will be resolved. But in case if you have to drive or you have to focus or you have to study, then you can go for a bit expensive levocetirizine as it doesn't cross the blood-brain barrier. And then if this is giving relief, but the local site is still red, so then you need to go for antibiotics. And in that case, go for the corticosteroid cream, say for example, Sofra-Cort. Sofra-Cort. So you have to apply it at a very thin layer. And then next, after 12 hours, within a day or two, that entire redness and everything will go away and will be fine. Right? All right. So here is, now we start with our today's session. Right? This would be a very
sorry to interrupt. Sir, actually, I'm going to buy a book for reading because I need to maintain that habit of reading because I lost it due to the exam, So I wanted to ask, should I skin first and then study it?
If were you present in the last lecture also?
Yes, sir, I was present.
Okay. So then what we said is, say skim and scan. This is what you should follow. So picking up the keywords first and then try to create some question. Even if the question is weird, no worries. And then read. Study type of reading will come only when you have learned the entire subject and then you want to read it from some other book. Tab ki baat tab, right? We'll come across that. Initially, your focus should be only on the keywords. And because if it is a physical book, so do mark those keywords with a different pen. The color which appeals you the most, right? People mark with different colors. Say, for example, I like say dark green color, right? Military green color. So my markers and everything, pen, when I write my own notes, so it is classically with that color. So it gives you that very deep happiness when you feel like, yeah, this is known to me. I like this color. So that those pleasure centers, they are activated, and anything learned with pleasure, you'll always remember. Right? Okay. So last time
Okay,
we
sir.
talked
Thank you.
about certain concepts, and there were few emails about lateral and medial and ipsilateral and contralateral. Contralateral. Very rapidly, we'll discuss it out. Okay, just a minute. When we talk about lateral or medial, it is always relative to each other. Because रेस है, ठीक है ना? You say मैं तो फर्स्ट आया, मैं तो फर्स्ट आई, ठीक है? रेस में कितने लोग थे? एक, तो फर्स्ट ही आओगे ना? This is exactly like that. Standalone lateral or standalone medial doesn't make any sense. Doesn't make any sense. This is the midline, right? The midline passing through the nose, passing through the chest, absolute midline. With this midline, let's say there are two structures. One is here and one is here. Let's name the structure. This is A, this is B. Which one is medial? Which one is lateral? Simple. The structure which is near to the midline. This is the midline. So the structure which is near to the midline, it is called as medial with respect to B. With respect to B. Right? If there is one other structure over here, so then this structure, right? Let's name it as Z. So that Z, that is medial as compared to A, as compared to B. Clear? Right? So remember, it is always as compared to some other structure. So A is medial and B is lateral as compared to A. Right? So this is one. Another thing which was asked was ipsi and contra. Yes, we can always say, so this is the right hand, this is the right hand, this is the left hand. So they both are on the opposite side of the midline. So they are contralateral. So very true that my right hand and left hand, they are contralateral to each other. True. But same principle over here. If this is one kidney and this is second kidney, they both are on the opposite side. So kidneys are located contralaterally. Makes sense? They are on the opposite side. But if you take this is the kidney, the right kidney, and this is right adrenals. So right kidney and right adrenal, they are on the same side. And they are on the same side of midline. So they will be called as ipsilateral. Ipsilateral means on the same side, and contralateral, that means they are on the opposite side. Yes, want to ask anything? Go ahead. You have raised your hand. Yeah, go ahead.
Okay, sir. Thank you.
What is spreader technique? अच्छा दोस्त एक काम करना, विराज, just go to this spreader.com, right? and just check it out. If there is any confusion, just send a mail again, and I'll talk about it. Sudhanshu, we talked about your 425. Your speed is 425. Extremely good. Very nice. New Fish's lifestyle.
So sorry to disturb.
हाँ नहीं नहीं बोलो ना.
For comparison between the midline, can we consider different positions as well? Like for example, you had given Z was in midline with respect to A. So is it only with A, or we can say like A and B, no?
A and B. That's what I said. See, Z, when we write it over here, right, when it is over here, so Z is medial as compared to A and B. Very right.
Okay.
B is lateral as compared to A and Z. But what will you write for A? Who asked this question?
Me, sir.
Udla. Chalo batao. What will you say about A?
A will be lateral to B.
And
Z.
Really? A would be lateral to B?
And medial to Z.
It would be medial.
Medial to B. Medial to B.
Exactly. Dekho. Right?
Sir, okay, wait. I'm still confused. Can you explain
confused? That's what I said. Chalo. A. Describe the A. Urula. Bolo. A is medial to whom?
Medial to B.
And is lateral to whom?
Z.
Correct. Okay. Now, I'm giving you one example. I'll randomly pick anyone. You have to answer this. 1, 2, 3, 4, 5. You have to explain 4, right? If we close our eyes, still you should be able to create this entire picture just by explanation. Remember, this image is not in front of me or our other friends. Randomly. Chinmay. Immediately unmute yourself. अरे यार अभी बहुत आज पढ़ना बाकी है फटाफट. चिन्मय. Hit. This is not good.
Yes, sir.
हाँ चलो फटाफट चलो. Explain 4.
4 is lateral to 1 and 2.
Yes. Okay. What about this?
He is lateral middle to 5.
No. You have to talk about 4 only.
Okay, 4.
So which new terminology will you use? Which new terminology will you use?
Contralateral.
Contralateral.
Exactly. So
Yes,
4
yes,
is
opposite side.
contralateral to 3 and 5. That means immediately we knew that 3 and 5, they are on the opposite side. 4 is over here. And when we are talking about 4 is lateral to 2 and 1. So that means 2 and 1, they are on the same side. And this 4 is lateral. So that means it is a lateralmost structure. Perfect?
Yes, sir.
Very good.
Sir. So
Chalo.
confusing.
One more. Someone is having confusion?
Yes, sir.
Bolo.
Can you please explain this?
Wait. Describe 3. Bhumi. It is totally fine to commit a mistake. Bas, par karo, chalo.
3 is lateral to 5.
Wait. Lateral means kya? Those lateral, malab whosoever is ye midline hai. This is the midline. Whosoever is near to midline is medial. M for M.
3 is respect to 5.
है ना? चलो भूमि again.
So then 1 is also near to midline, no?
Forget about 1, 2, 5, 4. वो opposite side पे है. वो भूल जाओ अभी. अभी just describe this. बोलो बोलो fast यार. Tejas. Tejas.
Yes, sir. Sir, 3 is medial to 5.
Correct. See, Bhumi, itna hi dekhna hai. Who is near to midline? So 3 is near, 5 is far, so 3 is medial to 5. Correct? And yes, Tejas, what about all these?
Sir, if we consider number 2, sir, 2 is lateral to 4.
Huh?
Sorry, 2 is medial to 4 and lateral to 1.
Barabar. And they are on the contralateral side, right? As compared to 3.
Yes, sir.
So bas, that's the thing. Right? I hope this is clear.
Yes, sir.
Yes, sir.
Yes, sir.
Moving on to the next one. These were the 3 planes which we considered. There are 3 planes. One plane which was called as the coronal plane. Coronal plane, it is easy to remember.
Crown
like
region.
Ground. So like this, right? That coronal plane is this. So it will, when you cut it from here, so what would happen? It will divide the body into front and the back. Correct? So when we cut it from here, so this is the coronal plane. So when you'll be taking CT scan or MRI, that is what is called as the cross-sectional. So in cross-sectional, so if we go for coronal plane, to cut. That means कि यहाँ nose से शुरू किया और cut करते, then we went all the way back. Right? So that's how we'll be able to see. So that is called as the coronal plane, also called as the frontal plane. So this plane is what we are talking about. Coronal plane. Right? Then the second plane, which is called as the sagittal plane. Sagittal or longitudinal plane. मतलब सीधा right from the big midline. So this midline, right? This midline is also called as the sagittal plane, is also called as the longitudinal plane, because it divides the body into right side and the left side, right? So that's how it divides the body. So right side and left side. So this is done, right? This coronal is one plane, sagittal is second plane, right? And the third one, you slice the body like this, horizontally. So that is called as the axial or horizontal or transverse, but this is self-explanatory, right? When we say horizontal or transverse, easy. So that is what is called as the third plane. But the entire body, as such, you know, this is the x-axis, this is the y-axis, and then there is a z-axis which is coming towards it. So when we draw this cube, well, what is that? This is in 3D. So bus, we have got one axis, we have got second axis, and we have got the third axis. Right? So height, length, breadth, and width. Right? So all those 3 things are defined. So same way over here. The body is in 3D. So that's why these 3 planes. There is one more concept.
Excuse me, sir.
Bolo.
Sir, I saw one video on YouTube and there was one more plane over here, which was oblique plane. I didn't understood that though.
No problem. We'll come to that.
Okay, sir.
Right? There is another plane which is called as the parasagittal. Whenever you come across the word parasagittal, para means near. So if anything is right in the middle, so we'll call it sagittal plane, right? Sagittal plane. But then what if we shift slightly on the right side or shift slightly on the left side? So it is dividing the body. Even if I shift it slightly over here, so it will divide the body, right? This is sagittal plane. But if I go with this, so that will also divide the body into right side and left side. They are not equal. I totally understand. But right side and left side. So that's why all these planes, they are called as the parasagittal planes. So that would be like, it will be parallel to sagittal plane. Achha. All the CT, all the MRI, all the cross-sectional radiographies, they are done in these 3 planes. But then comes you come across one structure. Let's say in liver, that's the liver. And then there is one SOL, space occupying lesion. Space
Excuse me, sir.
occupying lesion. This means SOL means space occupying lesion. That means there is something which is occupying a space and it is not normal. So that is called as the SOL. It could be a cancer. It could be a hepatocellular carcinoma, which is called as HCC. All these words will come, but just let's make it simple. It is cancer, right? Cancer of liver. We are not going into the detail what type of, but just a cancer of liver. You need to see this thing in more detail. Now, when you take sagittal section, you take the coronal section, you take the horizontal section, right? So that way you have to see those multiple plates, right? So you have to visualize that where exactly it is. Now, there is a concept what is called as the reconstruction of images. Reconstruction of images. We'll not go into the detail of Fourier analysis. It is called as the Fourier analysis. So it will come in post-graduation. But with Fourier analysis, you can just set the parameters and then you tell the computer regenerate, right? So computer will actually regenerate the entire image. So what it will do is, it will start getting, there is a concept which is called as the pixel, picture element, and then there is voxel, that is called as the volume element. So if pixel is your photograph, right? You take a photograph with your camera, zoom, till one point you'll find red, blue, green dots. Every dot is a pixel, picture element. So digitally, any of the image, it is made up of pixels. But when you make it in 3D, right, then there is a third component also added, and that is what is called as the voxel, right? We'll not dive more into voxel, but just consider there are 3 axes, so that there is a location also involved. In our patient, this tumor, so what you are doing is you are doing a reconstruction using the voxel data. And with that, when the data is finalized, that tumor, as if that tumor is right in front of you to come, and you'll be able to rotate and see. You'll be able to see which are the feeder vessels, right? And then you can merge it with other technology, which is called as the DSA, digital subtraction angiography. So you take one image, you inject the dye, you take the second image. From the second image, you delete the first image, right? By reversing the interpolations. And then you come across with tumor and then which blood vessel is feeding, as if you have opened the patient and you are watching him right in front of you. So for that, sometimes you need to scan at an angle. That is what is called as the oblique plane, right? Oblique plane.
Sir, I am blank. Can you repeat again?
Don't worry, right? This is oblique plane. This is oblique plane. When you scan at an angle, right? Regarding this reconstruction, etc., I'll show you practically. Right? It will be more clear, because you need to understand first how the cross-sectional imaging is done. I'll show you. I'll take the entire lecture on this CT scan MRI, right? So at that point, I'll discuss this thing again. So these are the 3 planes. Now, because we'll be starting with upper limb soon. So in case of upper limb, that's your hand. So in your hand, in anatomical position, you remember what was the anatomical position? You stand straight, right? Both the palms facing in front, eyes straight, open, right? Head straight. That was our anatomical position.
And
So
feet
both the
together.
palms,
Feet together.
yes,
Together.
Feet together.
feet together.
Last point.
Very good, very good, very good. Right? So this is when your hand is in that position, your thumb will be facing, the thumb will be on which border? It will be outside. So that would be called as the lateral border, right? There are 2 borders, and this would be the medial border, correct? Because when your hand is there, this side is the lateral border, and this side, which is nearer to the midline, it is called as the medial border. Now, in your forearm, there will be two bones, radius and ulna. So there'll be one bone over here, one bone over here. So radius is a lateral bone as compared to ulna. This is ulna. This one is radius. So radius is a lateral bone. But if someone moves a hand like this, then those bones, they will cross, right? No. Lateral or medial, we decide with respect to anatomical position. So with our anatomical position, when your hands are absolutely straight, so then it is very easy to say that radius is on the outer side, that means it is lateral. Ulna is on inside, so it is medial with respect to each other. With respect to each other. Okay? So that was one. Easy. Next is, that's our body. Right? That's our body.
Sir,
हाँ बोलो.
sir, why anatomical positions are defined by a person standing in front of you?
Why anatomical position क्या?
Why anatomical positions are defined on the basis of the person standing in front of you, not like ourselves?
Because one very simple thing. Say, when you will be examining the patient, what will you do? You will say कि चलो stand or sit in front, right? You won't say कि आजा मेरे बाजू में खड़ा हो जाए, then we watch कि हाँ patient को क्या हुआ है? You'll always be examining right in front. So that's why it is like developing the habit that as if he is standing in front of you. Same way, when you'll be learning radiology, always make a habit as if you are standing near the feet of the patient. So the moment you lift the x-ray, you know feet of the patient, and then accordingly everything is there. So you'll be developing that habit. You don't have to tell your brain again and again, kya oh, patient kaise tha? No, kuch nahi. One simple rule, and that's it. Which will you be following? So entire medical is made up of such simple rules, simple habits. You follow it, and you will be very comfortable. कोई confusion नहीं. Because X-ray दोनों side देख सकते हैं ना. उल्टा कर दिया किसी ने तो. Or if I say okay, this is the X-ray, right? I'll show you such cases also. And the heart is seen on the opposite side. First possibility, by mistake किसी ने X-ray उल्टा लगाया है on the view box. And the second possibility, that patient is having dextrocardia. Dextrocardia means heart is actually on the right side. It is a congenital anomaly, not serious, but yes, it can. When the heart has not rotated, because heart rotates, it has not rotated, so it remained on the right side only. Or someone can have situs inversus. That means all the organs are on the opposite side. So instead of liver being on right side, liver is on the left side. The stomach which is over here, it is on the left side. Right? Sab ulta. Everything ulta. So that is what is called a situs inversus. But you can identify those things just by the X-ray, simple plain X-ray, or by your stethoscope. Just put it and then you come to know. But it should be into your mind. That, there is possibility that such things that can really happen. Okay? Regarding this body, upper limb is up, lower limb dur. So there are two other terms which are called as the proximal and distal. P for pass or D for dur. Simple. Right? When we say that this muscle is attached, this is for the proximal movement. This muscle is for distal movement. This muscle is attached distally. मतलब वो muscle दूर attach हुआ है. So कैसे? There are again three structures we take. A, B, C. Everything is related to. Everything is with relation to, with relative to. So this is A. With respect to A, ये B and C की बात कर रहे हैं. तो B is proximal, C is distal. बड़ी सिंपल सी बात. B is near to the A, है ना? So ये पास है ना? और ये बेचारा C दूर है. बस इसको इंग्लिश वर्ड दे देते हैं. पास is proximal, P for P. दूर is distal, D for D. That's it. So now you know that yes, our fingers, right? Our fingers, they are distal to shoulder as compared to elbow. Elbow is proximal. Makes sense. Not at all difficult. Now comes few terminologies. In next 10 minutes, we'll go across all of this. And I would insist that you do all these movements along with me. So anatomical position, yes, it is like that, but the hand is like that. This is anterior, this one would be posterior in anatomical position, right? So for the hand, this is anterior, but we'll be calling it which surface? Palmar surface. Palmar surface came from the word palm. This is palm. So it is called as the palmar surface. So many times the word which will be used is that what are the muscles which are attached on the palmar surface? So we mean this surface. That means anterior surface. Right? What are the muscles which are attached on the dorsal side? The dorsal is this back side. Right? So that is palmar and dorsal. These are the upper limb movements, some movements. Flexion. Flexion extension to wo aise bhi aata hi hai, right? Flexion, when two surfaces which are coming together, two surfaces, right? They are coming together. So that is called as the flexion. Think from the perspective of lower limb. Lower limb में पाँव पीछे मुड़ता है. In anatomical position, from knees when you bend, as such the knee and elbow, they are same, no? But see, in case of lower limb, when the leg is bending, it is bending towards back side. When over here, the flexion is on the anterior side. Right? So we'll see in embryology that how the limbs rotate. Right? That is the reason. So flexion, two surfaces, they are coming together. Right? So that is flexion. Or uska ulta, extension. That is when you reverse of flexion is extension. When you straighten your arm. Flexion is always strong. In case of upper limb, watch the flexion. So when you watch your elbow, you'll find that these front surfaces, your biceps, they are much bigger, much powerful as compared to those muscles which are on the backside. Kyun? Because when you flex, you are going against the gravity. And when you extend, kuch nahi karo to bhi haath dham se girne wale hain wapas. Right? They will be falling back. So gravity is helping. Anywhere when the gravity is helping, they will remain weak. And when you are working against, so that would be much faster, much powerful. So that is strong. So flexion, extension, right? So flexion is stronger. Then comes abduction and adduction. Abduct matlab utha le jana. Abduct means to take away. Right? Or adduction is when you are going towards the body. That is when you are adding. So this is when we say which are the abductors. So yahan se deltoid contract hua to it is taking my arm away from the body. Right? So that will be called as abductor. Abductor. Right? When pectoralis major when will contract, to isne mera haath nazdik laya. So it is called as adductor. Correct? Sachin?
These
हाँ बोलो बोलो.
like terminology is similar to when you are like working out.
हाँ, when you are working out, absolutely, बिल्कुल.
Yes, I am like trying to understand it better now.
So this is the reason people say कि यार मतलब वो डंबल से ढप 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 ऐसे कर रहे, कोई मतलब नहीं है. Because when you are doing it rapidly, so then that momentum is taking it. But if you do very slow, you take a dumbbell and you flex it very slow, so that means you are working against the gravity, and that muscle has to really squeeze. All the actin, myosin filament, they have to really work. And when you are taking it back, so then don't just throw back, right? Take it slow, 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 slow. So that is when the gravity is trying to pull, but you are not letting it pull. Right? So this is the difference between active and the passive exercise. True.
So, sir, like it's the same when you are doing a bicep curl, then it's a flexion movement.
Flexion movement, but it is combination, flexion, extension, both. So
yes,
you are flexing, right? You are going against the gravity. It has to be explosive. But when you go back, go slow. Double the time. So it is like 1, 2, that way. And when you do this, say for example, kettlebell, when you swing the kettlebell, right? So when you swing the kettlebell, you're going against the gravity. But then you go force with force. But when you are coming down gradually, control the fall, control the fall. Don't let the kettlebell fall it by itself, right? Control the fall, and you'll find that your efficiency would be much better as compared to someone who's doing the same exercise.
Sir, then why are preacher curls more hard if flexing is stronger?
We'll discuss it on next Saturday, definitely.
Okay, sir.
Right? Because there are, if you read the book Arnold Schwarzenegger's Pumping Iron, right? He was not having any technique, but he was just following this. That gravity against the gravity, when it goes, go explosive, and when towards the gravity, go slow. But he understood just one this, and then he became Mr. Universe continuously for 9 years. When on the 10th year, that bodybuilding committee, they said कि दोस्त अब आप जज के हिसाब से आ जाओ, give someone else the chance. That is called as dadagiri.
Sir,
Huh?
can you please tell me the proximal and distal with respect to ABC once again, please?
Simple. See, there are three structures. Let's say this is shoulder, right? Shoulder. Then there comes the elbow, right? This is elbow. And then this is hand. So we are sitting over here. We are here on the shoulder. So who is Nazdik? Who is pass? Elbow or hand?
Elbow.
So we'll say that thing in stylish way, proximal. Right?
Yes, sir. Yes.
हाथ दूर है, so we'll say distal. Right?
Yes, sir. Yes.
Bas, simple.
Yes, sir. Thank you, sir.
Sir,
Then
is this same to medial and lateral thing?
Same to medial and lateral also. Yes.
Then why different terminology?
नहीं, ये जो है proximal distal जो है, that is when you are in any plane, there is near and far.
Okay.
Possible, na? Say for example, your question is valid. What if there are two structures? One is here, one is here. Ab they both are at the same distance from the midline. Correct? If there are two structures here and there into the same plane, so you can't say medial lateral because they are at the same distance as that from the midline.
Yes, sir.
But then you can say with respect to shoulder, yes, one is near, one is far. So that gives you
Then we'll consider different planes as one single plane. Okay.
Very right. Very right. Now comes.
Sir, sir, in the given example, you have given shoulder, elbow, and hand. What if I'm to determine elbow as my reference point and I'm trying to specify the position of shoulder and hand? So in those cases, proximal and distal won't have any meaning, right?
No, they won't, because it is like with respect to in one particular direction, who is near or far? Who is near or far, right? So it has to be in same line, no? Because if it is in same line, then we say that this structure is near and that structure is far. If they both are at the same distance, then to fit they both are at the same distance. You can say for example, I change it to head. So now you can say that head is distal as compared to hand. But not in the same line. That's okay. But yes, from elbow, our head is far as compared to hand. So that you can do. But they are in different direction. That's okay.
So they need to be at a greater distance for distal and proximal to be valid.
Simply the distance.
Otherwise, they
point
need
to
to
point.
be in the same direction.
Correct.
Okay,
right.
sir.
Then comes, this is pronation and supination. When your hand goes like this, because see, that's how the move. So this is what is called as pronation, And when your hand is sleeping, so it is called as supination. To remember, king's pronate. जिनके चलो यार दान दिया लो, right? So king's pronate, they are giving. When you are giving something, so you are doing the movement of pronation. When you are asking for something, it is supination, right? So kings pronate and beggars supine. This example is from Greek books because that's how they used to give, right? There were kings and beggars. So they say kings pronate, beggars supine. But we remember it like just remember one, second will automatically be remembered, right? So kings pronate. That's it. So when we go like this, it is pronation. These movements, pronation, so that means there has to be a muscle, right, which will be connected to ulna and on the opposite side of the radius and will pull and will give the rotation, right? Because there are two things. So muscle is there, one pulls and it rotates. So we'll be telling that name as pronator, right? Then there'll be pronator teres, pronator quadratus, all those muscles. Quadratus, quad means square. So because that muscle is quad shaped, right? It is like a square shape, and then it is doing the function of pronation. So that's why we are telling name of that person. So knowing these, say abductor pollicis, all these muscles name. So people would wonder कि यार क्या खतरनाक नाम है? नहीं, कुछ खतरनाक नहीं. It has come only from its function. So once you know the function, it becomes so easy, right? So this is pronation and supination. And then circumduction. Circumduction or kuch nahi, it is bowling. When you are bowling, so you are rotating your hand, entire hand like this, right? So when you, that movement, first in one word, when you are bowling, right? So that entire hand moves, that is what is called as the circumduction. Full movement. Complex movement, because muscles at all levels, they come into picture. Then rotation, lateral and medial rotation. So the hand is in anatomical position. Think about that thumb, right? That thumb, that is out. So when you can rotate in or out, right? Just from the movement. So when over here, so this is inside movement and this is the outside movement. Inside is called as internal rotation or external rotation. Lateral rotation outside, medial rotation inside, right? So that is what is called as the rotation.
Sir, can you explain the 7 point again? Circumduction.
Circumduction bowling. You play cricket, you watch cricket.
No, sir.
Nahin? Bumrah yesterday took a fiver. Yeah.
I don't like it.
Okay, doesn't matter. But at least you know bowling.
Yeah.
So that is circumduction. That is circumduction, right? The entire movement. Yes.
And one.
Hello.
Yes, Anaya.
Actually, sir, I had a doubt regarding someone asked you a reference point between the elbow, hand, and the shoulder. And when she told that if you keep your elbow as the reference point, then the shoulder and your hand would be at the same length. But that wouldn't be the case for everyone, right? Because everyone's shoulder length and the hand length will be different with respect to the elbow. So we can see it, right?
So why to think so much complex? Anything which is near is proximal. If it is far, to it is distal.
Generalized thing, right?
Generalized. Abhi to specific to will take. This is all generalized. Just to understand the concept. Simple. Anything which is near is proximal. Anything which is far is distal.
Okay, sir.
So the flaxation and the adduction are the same, right?
Which one? Flexion and adduction? Nine. They are not same. Plane is different. When you are in anatomical position, you are lifting the dumbbell. That is flexion. But if your elbow is going out, away from the body, away from the midline, that is abduction. right?
So,
Because
it was like two surface coming near and
two
towards the
surface
wall.
coming near, huh? So when two surfaces they are coming near, right? So that is called as flexion. Over here, so if it is going away from the body, so then the terminology changes because the entire muscle groups would change.
Okay, so it means the adduction is towards the medial or something like that.
Towards the body, towards the body. Yes. So when the hands are like this and they are coming near, so they are coming towards the body. So if they are getting added to the body, right? So it is adduction. When they both are going out, so it is called as the abduction.
Okay, sir. Thank you.
Sir, can you explain pronation and supination again?
हाँ. So दान दिया है, दान किसी को देना हो, दान ले बेटा, दान.
Yes.
You are doing pronation. And when we say कि daddy 100 रुपया दो ना, girlfriend को चाय पिलानी है, so then that is called as supination.
Okay, sir.
Easy na?
Sir, I have a doubt. Since you watch cricket, I have an example from it. Sir, like Malinga's action is quite unorthodox. So, will that action be the like protonation which you said?
Malinga's action is he throws from the side, right? He is
Yeah, so
not
will it be
for
circumduction?
full circumduction. The normal bowling is full circumduction. Normal bowling is full.
So,
What?
can you explain 8 point again?
Which one?
Rotation.
Sorry. Which point?
8 points, sir.
8th point. Rotation. Rotation is in anatomical position. You just keep your hand and take the shoulder in. Take the shoulder in. Right? When you do like this, so that is internal rotation. You are going towards the medial plane. And when you do this, when you open, when the shoulders, they are going out. Right? Best is when you go like this. So it is external rotation. When it is coming in, it is internal rotation. Right? The movement is on the long axis. Right? यहाँ से move हो रहा है. Got it?
Yes, sir.
The next one is
Sir,
in case of
sir, what is the difference between adduction and flexion?
we discussed that now. When you are when it is the upper when limbs, right? When these two surfaces, the same organ, two surfaces, they are coming near to each other, that is flexion. And adduction is body is different, upper limb is different. Right? So when they are coming and closing, when this upper limb is coming near the body, it is called as adduction. When hand to hand hai na, it is the same organ. Right? So when they are coming, when you will bend, right? When you will bend, when the body bends, so it is called as flexors. Because the whole body is same. Right? The body is same, abs are same, so it is bending, so it is called as flexion. And when you straighten, it is like extension. Now for the hand, for the hand, this middle finger is considered as central axis. This is where now the things will start getting complicated slightly. When you do this, your fingers are going away from the midline. For hand, this is only for the hand, right? These two hands, for no other organ. Only for the hand, right? This is not considered as a central axis. For hand, this finger is considered, long finger is considered as central axis. So when we say abduction, दूर गए, adduction, नजदीक आ गए. Abduction, adduction, abduction, adduction. Adding to the central line, but for the hand, central line is this finger. Remember that, right? So here, the keyword is that it is with respect to the long finger. With respect to the long finger, you are dealing for the abduction and adduction long axis, right? So it is the long finger. Is that clear? Right? So when we do this, and you will find, as such, if you'll find, you try to move, you'll find that a long finger is not moving much. Right? When you randomly do, you'll find that this line is almost straight. It is not moving much. Right? It is because the muscles, they are, when we'll discuss the palm, there are 4 layers of muscles. And there you'll find that there is one group over here, one group over here, and this group, right, which has got bigger muscles. Right? This is what is called as the thenar group. This is hypothenar group. So that's how they will all be functioning. You take the fingers away or towards. Right? But this middle one, oh, hamesha, because the muscles will be attached on both the sides. So they both will pull and will keep this in center. So that is. In case of thumb, when you are doing this, 1, 2, 3, 4, 5, 6, 7, 8, right? When you do this counting, right? So like this, like this, like this, like this. So that is, all these things, they are called as the opposition, right? You do this, 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 you do this, this, this. So that is called as the opposition, touching fingers, fingertips. So there is a specific muscle which is for this opponent's movement. It is called as the opposition. Opposition. Opposition means touching fingertips. Say, for example, muscle's name is opponent's pollicis. Opponent's is a movement and pollicis means thumb. This is called as pollex. Pollex. When it comes to big toe, it is called as hallux. Hallux. That's why the name of the muscles will be hallucis. Over here, it is called as pollux. So that's why it is called as pollicis. Pollicis. Pollux is hand. Hallux is foot. Right? So the names, yes, we have to remember. All these muscles, they will be coming into picture. Right? So flexion, extension, and abduction, adduction. For the thumb, the axis is different. Now, this being the last hours, now just some of the things are left out. They are very easy. You have understood flexion extension properly. You have understood abduction adduction properly, right?
Yes,
You
sir.
know, in case of hand, it is abduction and this is adduction. Even that is clear.
Yes,
How
sir.
comes,
Yes, sir.
how comes for the thumb? Thumb is rotated at 90 degrees. So when I say this and this, right? This and this. This is flexion, this is extension. Right? You might say it has to be like this. It is like this, this. And when you do this and this, right? So in this plane, right? When it is going like this is abduction. And then when it is resting down, it is adduction. Bas, itna dhyan rakhna. When it is going like this, it is abduction. And when it is coming like this, it is called as adduction. More when we'll be studying this hand, when you'll be learning the muscles also.
Sir, can you repeat the flexion and extension for thumb?
This. Say flexion is when you are doing this. Flexion, extension. And when it is going abduction, adduction. The right level would be when say this is the palm and it is going away, and then this is coming back. You'll be able to understand it very crisply when you'll understand even the muscle attachments. So it will be very easy. This terminology you should know. Intrinsic means the muscle is in this region. यहाँ से शुरू हुआ यहीं पे खत्म हो गया. It is called as intrinsic. But if it is crossing the joint, so it is called as extrinsic. It means that there are some muscles which will be starting from our forearm, and then they will be going all the way into fingers. Right? Say, for example, flexor digitorum superficialis. The name is so fancy, right? Flexor digitorum superficialis. लिखने की जरूरत नहीं, जस्ट याद रखना, मतलब समझना. Flexor, it will be flexing the fingers. Kyun? Digitorum, they are called as digits. They are called as digits. So they will be flexing the digits. Right? Superficialis, मतलब the muscle which is superficial. इसका मतलब क्या दूसरा भी कोई muscle है deep में? Yes. Right? And it is a big muscle. So that's why we'll be calling flexor digitorum deepalis nahi, profundus. Flexor digitorum profundus. Because this superficial muscle is thin. Deep muscle is big. So that's why we say profundus. Profound means khub sara. So khub sara muscles is at deep. So that's why we call it flexor digitorum profundus. So short में फिर लिखा जाता है कि FDS and FDP. Right? So flexor, digits means fingers, they will be flexing, and superficialis, this muscle would start from elbow and then all the way. It will start with forearm and it will go all the way into the palm. So that's why it is crossing the wrist. We'll be calling that muscle as extrinsic, right? Crossing the joint. Crossing the joint. Intrinsic means there are many muscles which are present here only. यहीं से शुरू हुए यहीं पे खत्म हुए इतने छोटे छोटे muscles, all those miniature small muscles, because their movement, their function is very specific, so they are called as the intrinsic. They don't cross the joint, they start in the region, end in the region, there only, right? So that is intrinsic and extrinsic. Then we'll see the muscles again. All these terminologies will come. Muscles, when we say muscles, we'll always study the muscle in this way: origin and insertion. So say for example, pectoralis major, which is forming your chest, right? So this is the sternum. It will start with the sternum and all the way it goes on the humerus, this bone, right? It goes over there. And then when it contracts, it will, if the hand is like this, it will pull and it will get the hand back, arm back, right? So that is one point is one attachment, second point is second attachment, and because they can contract, so that's a mechanical thing, right? From here to there is a spring. When the spring contracts, so it gets that object near. So there is origin insertion, or it is called as fixed, and the moving end. This hand is moving, right? So this hand can move. This pectoralis major, right? Name is pectoralis major, big muscle of chest. Pectoralis means it is associated with chest. So when it contracts, खींच के हाथ को वापस ले आया, right? Attachments, proximal or distal, right? कैसे? With respect to the body, right? So if there is one muscle which is attached over here, it is near, and second end is connected over here. So this is distal, this is proximal end, this is distal end. ये बॉडी के नजदीक है, वो हाथ पे जो लगा है that is दूर. So that's why proximal and distal attachment. I'll be showing you multiple figures that when we'll see, yes, there are, say for example, any muscle which is connected here, and then its distal end, dur ka end, is connected with fingers. So this is the proximal end, and then dur ka wala is distal end.
So then the distal will be moving.
But in some of the cases, what you have to remember is which end is a moving end. In some of the cases, both the ends can. One will be fixed, other will. This will be very helpful when you will be designing the exercises. So for example, when you do the dips, but the moment you take the dips like this, right, and then you do the dips, the entire pressure changes. All the new group of muscles would be involved. So that's why now see the difference. With this knowledge, you'll be defining the exercise in very nice way. For the muscle, there would be one part which is called as the tendon. Tendon cannot contract, right? This is the muscle. So muscle is that belly, that flashy portion. When you take biceps, so that is a soft thing which can contract, but it is connected with tendon. Tendon is tough structure. T for T, tendon is tough structure and it is connected to bone. It won't move. it won't elongate. It is a fixed size, right? But it is acting like a majboot rassi. So all the
Tendon is
muscles,
bone to bone, na?
that is ligament, right? Over here, this is a ligament, right?
Sir,
Huh?
tendon does not allow any movement, but ligament allows.
They are for the strength and stability. Strength and stability.
Okay.
Sheet. This is flattened tendon. Aponeurosis. It is called as the sheet. Say, for example, in the abdomen, right? So when there's a six pack, so six pack is what? There is rectus abdominis muscle, and in between there are tendinous structure. In between, they are giving the attachment so that the entire abdomen doesn't open, right, with the pressure. So they are giving like sling points, pressure point. So that is when the fat is not there. So this will be looking like that six packs. So it is called as aponeurosis. When the tendon is flat, it is in the form of sheet. In dissection, we'll see all these things. Then here is the heart. Anything which is going out is called as artery. Anything which is coming to heart, it is called as veins. Artery to veins. So arteries, they will be carrying oxygen. Veins will be carrying carbon dioxide normally. There is exception. Pulmonary trunk, right? Because from lungs, the entire circulation, it goes something like this. This is the heart, right? This is the right side, right atrium. This is the left atrium, left ventricle, left atrium. So from here, blood goes out into the aorta. This is having oxygen. Body uses it. So oxygen gone. Now it is having carbon dioxide. It comes to right atrium. From right atrium, artery goes out. Now see, this artery goes out, which goes to lungs. It is called as pulmonary aorta. So this is carbon dioxide, right? And then lungs will purify it. That means it will be adding oxygen. It will take away the carbon dioxide and it will go into the left atrium. So see, this is also artery, pulmonary artery, which is taking blood to the lungs, but that is carrying carbon dioxide. Right? So this is the only exception. That is what is called as the pulmonary trunk. And in fetal life, when we'll be learning the fetal circulation, that is how the blood really flows into the baby neonate, right? So that is where, when we say that this is the mother is giving oxygen to the baby via umbilical vein, right? And that blood, when it is returning, right? So this is called as the umbilical artery. So baby's carbon dioxide is taken in that. So thus, when we talk about arteries, they usually carry oxygen. Exception is pulmonary trunk in you, me, everyone, in adults, and umbilical artery in case of that fetus, right? Someone who is yet to born. Similarly, pulmonary vein. So veins, they will be carrying carbon dioxide, except in case of pulmonary vein and umbilical vein, they carry oxygen. So here is left ventricle, two aorta, two branches. They divide arterioles and these capillaries, that is where carbon dioxide, oxygen exchange occurs. And then once again, those capillaries, they combine to form venules. Then they are called as tributaries. And finally, they form a big vein, which goes into the form of superior vena cava and inferior vena cava, and they land into right atrium. Right? So this is a full circle. This anastomosis component, this is like a backup system. in some of the cases, what if one part is blocked? So then blood will pass via another route. This can be seen very effectively in coronary angiography, heart. Right? So that is where we'll see. But this is nothing but a bypass. Right? It is nothing but just a bypass. Say, for example, this is 1A, this is B, and this is the normal path. But what if one day it is blocked? If it is blocked, so then this is the another path which has been formed, and this is a bypass. So normally no traffic will be going on the bypass, but it would be utilized when there is one block. Right? When there is one block. So this system, collectively the whole system has been given a name, anastomosis. Anastomosis. There are several anastomosis which we'll be learning during angiology, that is study of blood vessels and veins. This was one of the example, that brachial artery, which is dividing into radial and ulnar. Brachial, the main artery of our arm. So it goes and then it divides. But then there is one artery which is called as radial recurrent artery. This radial artery, right? Radial artery is that where you take the pulse, right? Thak, 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 pulse. Pulse, they come into the ulnar artery also. But radial artery is sitting just on the bone. So you have got a strong surface below to feel that pulse. So that is what is called as the radial artery. And that radial artery feels like a name. I need to talk to this big artery, which is called as the profunda brachii, right? Profunda brachii. So there is one branch, antedescending branch, it is sent by profunda brachii. In radial recurrent, see the name is so easy. Radial, that is into your elbow, it has to go up against the current. So it is called as radial recurrent, right? And this big artery, it tells ki ja niche jaake mil ke aao radial ko. So then this is called as anterior. See, can you create a picture? Anterior, it is in front. Descending, it is going down. So there is anterior descending branch which is going down, and it is meeting whom? One artery which is coming ulta, upar aa rahi hai, right? It is called as recurrent, coming from radial. So that is where they both meet. They'll say ki abhi kuch nahi, right? This is not making any difference. But someday, if this is blocked, so then the blood will start circulating via this path. So they are called as anastomosis, right? Anastomosis. That is the backup system. You'll find in our body there are so many anastomosis, various, and their functions, they are so different, right? Especially when we'll be talking about portal hypertension. That is, what is the portal system, we'll discuss. And what happens when there is increased pressure. So why it happens ki neck veins, they become engorged. Umbilicus, right? Near the navel, right? They'll be as if arteries, they are coming out, right? So it will look like that, like spreading across. Those persons, they develop blood in the stool, hemorrhoids, piles. क्यों liver में problem और वहां जाके problem हो रहा है? Because that is a bypass. So because of portal hypertension, pressure is increased. So those delicate vessels, they break and person starts passing stool, right? So in portal hypertension, similarly, esophageal varices, person, they vomit the blood. क्यों? Because this is esophagus. Esophagus is our pipeline, right? Food pipe. So that's the esophagus. And then we have got the stomach over here, right? The stomach over here, then duodenum. Now this area, we'll study that it will be having the direct connection with the liver. So very delicate vessels are lying over there, which are called making that anastomosis. Nothing would happen, right? But the day the pressure increases, these blood vessels, they become so prominent and they burst. When they burst, this is the blood. Yahan pe there is a valve, right? That valve opens when the food is going in. Food is not going in, so blood bursts. That blood will straight away start traveling up and person would vomit. A frank red blood. Frank red blood. So just by looks at the blood, you will say this is a frank blood. It's coming from the esophagus. Take the pressure and your diagnosis, and you examine the body, just inspection, and you'll come to know. Ask the history, you will know. Yes, patient will say blood is getting passed into the stool also. diagnosis, you do the ultrasound, and you'll be able to make the entire judgment, right? So every time, whenever we'll be discussing anatomy, every time, let's hope that you stay. And so when we are discussing even the medicine, that is in the third year, so things will go always like this case. We'll always be starting with a case. Right? This is a patient, young patient, smoker, heavy drunkard, alcoholic since 10 years, 12 years, and then not taking any nutritional food, and then started developing these signs, symptoms. He's losing weight also. Right? And then you have to guess what could be the diagnosis. So we'll write all of them. And then I'll give you, okay, have this CT plate, CT scan. You watch the CT scan, you say there is hepatomegaly. Oh, so then that means we are dealing with the liver. So all other causes eliminate, right? For the time being, if your liver comes out to be completely normal, so then baat alag. But so that will be like, we'll reach to the diagnosis and then we'll be learning the topic. Right? Same thing will happen even in when we'll be learning anatomy also. But the only difference is that I'll be giving you some simple cases. But when we'll be discussing medicine, we'll be using real cases. In anatomy, while learning anatomy, I'll show you all those cases at the end of our session. Right? So first you know the normal structure, then I'll show you the abnormality. Right? So that would be our pattern. So this is the importance of knowing the blood supply. Right? So that you know that what can really.
Sir,
So
does our body ever stop maintaining the backup systems?
no,
Because
never. The body has got.
But it might never be used, na?
Sorry, again. What did
But
you say?
it might never be come into use. na?
Bilkul. Say even in our heart, right? Even in the coronary angiography, right? Coronary system. So that is where the heart is getting the blood. Heart is like a cashier, right? So from the aortic sinus, there would be one major artery which will be going like this. It is called as the common left coronary artery. And then there is one artery which will be called as the left circumflex artery because it winds around. And then there is a right coronary artery, not carotid, coronary. Right coronary artery. So this is supplying to the right side, this is supplying to the left side, and this is the back side. Now, in between also, there is development of so many new blood vessels. So all these blood vessels, they are like backup. Now it takes years to gather. So that's why it is said that if anyone who is 50 plus, he gets a heart attack, myocardial infarction, and if someone of the age of 20, he gets a heart attack, chances of survival of this person is very less. Very less. First attack.
Because they did not develop.
Because the things have not developed. That's right.
Oh, okay.
Yeah, and as you exercise,
sir.
right? As you exercise, all these extra circulations, they start developing. So it is like a very, very protective thing. When you do power exercises, right? So it develops. Sudhanshu.
Sir, what are the external symptoms of that the backup system has been activated, or how can a person know if the
there are hundreds of such circulations. So all those circulations, etc., that is we'll discuss when we'll be discussing that specific region. Right? This was just an example that this is how our body is. Because otherwise, so these backup systems or the anastomosis, in our entire body, there are so many anastomosis. There are anastomosis in the brain also. There are anastomosis in upper limb, lower limb, abdomen, in pelvis, so many, right? So many areas. So there is no one rule for this. So that will,
is this system is near to the heart or any other place?
Any other. There is nothing like near to the heart. This is the for heart. This is not near to the heart. This is on heart. For bhi kya? It is on heart. What we are habituated. But these are like anastomosis. They are called as the. I wanted to emphasize the word anastomosis. That means it is a backup system. It is a bypass system which is present in many of the organs. Right? So normally those will be thin vessels lying, just sending some blood, not doing much. But the day it is needed, yes, everyone will come into picture.
Okay, sir.
All right.
Sir,
Huh?
can you show the sheet slide?
Sir, is there a limit to backup plan? Backup system, sorry. Like you said, it develops over ages, na? Like during times.
In case of heart. Baki, say for example, in case of upper limb, so right from the birth it is there.
Acha, okay.
Because say when we are moving our hand in certain location, right, that the nerve, that artery or a vein, it gets pinched. So sometimes pata hai, when the blood pressure is taken, तो then they say करे हाथ में झंझन हो रहा है.
Ha, yes, sir.
Right?
I understood, yes.
Was stopped, but hand tissues, they never died. Major vessel was stopped, but by other the blood was going on, so they survived. But hand said, I need more blood. So these backup systems, they are there.
Sir, during paralysis, the doctor
Paralysis is
says that the nerve.
totally different. Paralysis is lack of when the nerve communication is cut off. Electrical system goes away. Paralysis is what? When person can flex his head. There are various types of paralysis. One what is called as the spastic. Spastic means person, the hands, they have gone like this. Now he is unable to open, right? It is because there is a very beautiful balance between flexors and extensors. That's why we can keep our hand like this. If these muscles are working normally, but extensors, they stop working, the flexors so normal काम करेंगे, हाथ ऐसे हो गया. So that's why in some of the cases, hand like remains like this because of the flexion overstimulation. Flexors are stimulating. So brain is constantly firing to flexors. Kare, kaam kar. They are overdoing it. Or there can be failure of extension. Haath aise to ho gaya. But now person cannot straighten his hand because the nerves which are supplying to extensor group, those nerves have been damaged. So these muscles, though physically present, muscle बोलेगा हमें बोलो तो हम काम करें, पर उनको information भेजने वाला, that path is cut. So no one is telling those extensors के बेटा contract. हाँ, तो they are not contracting. तो ऐसे पड़े हैं, right? While flexor से हम तो अपना normal काम कर रहे हैं. So hand has gone like this, right? So they go like this only. So there are sign symptoms. Just by the inspection, you'll be able to say okay, what must have happened. And then it comes to your differential diagnosis. Okay, is the nerve cut or the problem is into the central region, that is in the brain? And if it is in the brain, so then it has got the wide effect. Because it is like okay, if our main electric board, if there is some short circuit over there, पूरे घर की light चली गई. And if anything happens to this wire, so then only this room would be affected. Same way, it is like an electrical system. Right?
So,
that's why we'll be learning things in so much of detail. Huh? Yes, Tanvi.
So one of my family members, their radial nerve was damaged. The doctor said we needed physiotherapy or something like that to get through it. And now the person can write and do everything, hold the things. So is that possible? The nerves can be restored or something
Yes,
like that?
this is like there is degree of injury. Degree 1, degree 2, degree 3. If it is the damage to level 3, so level 3 is an absolute cut. No chance. No chance. After years together, if something is done, then some movements they come. But otherwise, not like a full-fledged thing. Right? Unless
But in means we studied in the biotext that they said that the nerve cells never regenerate or recover.
means it is not the nerve, it is like there is a myelin sheath, right? There is a myelin sheath. So once it is a full cut, then it would be taking hell lot of time, but it will never come back to the original. We'll see that thing in nerve injuries.
Sir, can you please show the sheet slide?
Which one? Just let me know when to stop.
Yes, this, sir. Yes, this. Thank you, sir.
All right. So, any more questions? Yes, quickly.
Sir, can I ask?
Go ahead.
Sir, why not all backup systems are present from the birth? Chances of
Not needed, na,
survivability
because
will be more, no?
main pipeline is much better. Na? Why to go for the bypass route? When we have got the highway, so why not to go on highway? Why to go for that short path, that smaller path?
Chances of survival will be higher then.
No, that path will be effective only when it is needed. Otherwise, so let the blood flow, let the traffic go on the highways. Those bypasses, they are made only when it is needed.
Oh, so you must be, you have to suffer from something before the backup plan starts to develop.
Correct.
Okay.
So does a backup plan have any limit, or like how does it work?
No, that we explain. There is a suggestion. Now someone has come. Okay, chalo, we stop at this point, right? And we meet day after, that is on Tuesday.
Sir, one last thing.
Send a mail, right? I'll take that. Okay, so take care.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir. Bye, sir.
Thank you, sir. Bye, sir.
Thank you, sir.
Bye, sir.
Thank you, sir. Bye.
Hi, sir. Thank you, sir.